talking about endometriosis today. So, what is endometriosis? Essentially, it is a chronic disease that's very painful, and it's tissue that is similar to the inner lining of the uterus, which is called endometrium. And this lining will grow on the outside of the uterus. And so every menstrual cycle, this inner lining will pass through as blood, but those with endometriosis, it will sit on the outside of that uterus, or the blood will sit on the outside, and that becomes very painful just because blood is an irritant, and it also, the body will also send like inflammatory responses to come and clean up that blood, which will just increase bloating and pain in the area. And some major body parts involved, I've already mentioned it, but the uterus and the surrounding ligaments of it, as well as that outside surface, and the ovaries, fallopian tubes, and just other pelvic organs. Some causes of this disease are a little unknown right now. However, there are a few theories that's been proposed by experts. One of those include retrograde menstruation, and that is essentially the menstrual blood that has those endometrial cells. It'll go pass through the fallopian tubes of the pelvic cavity, and then it has that chance of sticking up against the pelvic wall instead of flowing out of the body. And there it can just thicken and develop through every menstrual cycle, which you could see how it could become more and more painful because of that. And also there's transformed peritoneal cells, and those are just hormone and immune functions that kind of help transform those peritoneal cells, which are the cells that line the inner side of the abdomen. And those cells kind of turn into cells which are similar to the ones on that outside of the uterus. And then there's embryonic cell changes, and so hormones like estrogen can transform embryonic cells into endometrial cell growth during puberty. Some treatment options for endometriosis is some NSAIDs. So these include like painkillers and just over-the-counter ibuprofen, naproxen, and these are just those medications that'll help with pain and inflammation. And then there's hormonal and contraceptive medicines, which can be like birth control, IUDs, and so on and so forth. And then those who really experience a lot of pain will resort towards surgery, if this is necessary for them. Some prevention methods. There's not really a known way to prevent endometriosis as of right now. However, there are ways to reduce the risk of it. And one of those is just regular exercise. And this helps to lower the percentage of body fat in the body so that there's not just estrogen, there's like less estrogen circulating through the body. Another thing is caffeine and alcohol in moderation, because these two things are known to raise estrogen levels, which can be an issue when it comes to endometriosis. Some more interesting facts that I learned throughout this was that there's pains during periods, sex, and then urinary outputs, as well as bowel movements. And then also there can be heavy periods, and there's just more excessive bleeding during menstrual cycles. And then it can also cause infertility, so women who have it tend to have more difficulty having children. And lastly is that it will improve after menopause, except it doesn't always happen. And that's something I found really interesting, just because it's like, well, if a woman has gone through menopause, they don't have their periods anymore, but why are they still experiencing pain? And that is the whole presentation. Thank you for listening, and these are my references. Thank you.